think the most important thing is putting the patients first, and their wishes are often to go home. And that is what we would like to do, is to get them home first. And that's the whole point of our service.
The Home First team is a team of multidisciplinary individuals consisting of nurses, therapists, administration, colleagues, local authorities, social services, community workers, whose primary objective is to get people home first.
One of the most important things about the Home First team is that they are able to problem solve and deal with issues as they arrive, because what we don't want is for patients to be readmitted back into hospital.
It's a really unique way of working together with system partners, so the local authorities, Sirona as the community provider. We've got really good voluntary sector services, and we can work together now, co-located in the hospital, to make sure that the right person is doing the right job for the patient at the right time.
And what that means to the patient really is that then they're not having to have repeated conversations, the same conversations with different people. We want to make it easy for them to understand what's going on through their pathway to discharge.
As a new service, our first challenge is going to be working together so that we can create strong professional relationships.
It can also be challenging just trying to gather information in the most timely manner. For example, if you're needing to speak to family members and they're working full time.
The challenge in what the patient's wishes are and the family's wishes, and they don't always agree. And so we manage expectations.
Overarching of the challenge is about using our resources and our services to the best that we can in an effective way. It's also about using staff and supporting staff so that they feel comfortable doing their role.
Depending on the capacity in the community, sometimes it's quite hard to provide the level of care that is expected by hospital staff and family of the patients.
The biggest challenge within my role would be communication between us, the communities, the social workers, the doctors, the nurses. The most challenging thing is keeping that communication all together, but that's my job.
I wanted to become an acute trust case manager to help facilitate people to get home quicker from hospital and to help with the operations side of freeing up the beds within the hospital environment. And it's about, I get to spend that time with the patient, finding out what they want, along with the family on what they want.
I just really enjoy the challenges and the rewards that it brings from working with such a diverse group of people. I'm quite recently relocated to Bristol and I'm really loving that about this city. It's a very progressive city, there's a lot of diversity, it's very open, and I'm finding that within the workplace as well.
One of the things I enjoy about my role is to be able to support people at quite difficult times and to be able to help them through that difficult time and to make it easier for them.
I wanted to come away from direct nursing care on the ward and wanted to understand how I could use my experience of many years working with patients and families and the skills, how I could bring them to help with complex discharge planning. I like the variety, working independently as a case manager, but also working with colleagues to solve problems, to realise that we can get patients home with a lot of support that maybe we thought, or I did in the past, wasn't necessarily possible.
We know that patients decondition in hospital beds. Immobility leads to extensive muscle wastage, meaning that our patients will not be able to mobilise as long as they are kept in bed. That's why it's so important we get them home, we motivate them to go and see their plants, to see their pets, to have visits with their loved ones, to potter about and do what they love to do. That's really important because not only does that give them quality of life, but it also enables them to be as independent as they possibly can be.
I would 100% recommend working in the Home First team. It's changed my outlook on the whole hospital in general. My communication skills face-to-face with all members of staff has changed. I'm way more confident within talking to people.
Yeah, I would highly recommend working for the Home First team. People are just really willing to sort of bounce ideas off each other and share information.
The Home First team have to make quick decisions and problem solve to make sure that patient is safe when they return home. So I think it's a great way of improving your skills and knowledge.
I would recommend Home First. You're going to be looking at the world completely different from what you've done through being on the wards working. It brings its own challenges and rewards each day. It gives you that opportunity to have that close contact with your patient when you need to and see them who they are.
The Home First team will be a group of people really trying out new things. It's an exciting time to join a service who essentially in many ways will be ripping up the rule book. So we will be looking at ways of redesigning pathways, we'll be working across organisational boundaries. It's a completely different way of working. So I think if you're somebody that is interested in trying out new things and being at the beginning of something which I'm sure will go further and develop more, it's a good time to join.
There is a fantastic amount of buzz around it at the moment. The idea is exciting to both community partners and to the hospital.
So if you think you are somebody who wants to work in a team where it's recognised that time is the most important currency and the aim is to respect patients to live as independently as they can, then Home First is the team for you.
Come and see us, come and speak to us, come and meet us as a team. Everybody's welcome. You'll be surprised at what we do.
We are the Home First team.
Working from hospital to home.
Where every minute matters.